Hello friends and welcome to my channel. I am your host Dr. Santosh, ENT and head and neck surgeon, and today we shall be looking at some benign conditions that affect the oral cavity, and these are the rarer subset of clinical conditions that we don't get to see on a day-to-day basis in our clinics. This is called a naked tongue because there is complete atrophy of all the tongue papillae, leading to a smooth ball tongue. This is commonly seen in severe anemia and also B12 deficiency, pernicious anemia. Before the era of antibiotics, Streptococcus bacteria used to frequently cause scarlet fever. Scarlet fever is also known as scarlatina. Scarlet fever produces characteristic rash throughout the body. The rash produced over the face is called malar erythema. Here, the redness involves most of the face but spares the area around the mouth. The rash that involves the body has a characteristic rough feel to it. That is why it's called a sandpaper rash. It usually begins in the flexures, usually behind the ear, and spreads slowly throughout the body. And in scarlet fever, you get the classic strawberry tongue, which is not very commonly seen nowadays. Here is a picture of a strawberry tongue. In addition, unusual donut-shaped rashes on the mucosa were also seen, and here is another picture that shows you these donut-shaped rashes of the mucosa. All these lesions are caused by Streptococcus pyogenes infecting the throat. Observe these unusual ulcers found in a patient with immunosuppression. As you can see very clearly, these are punched out ulcers and they are caused by cytomegalovirus that has become activated due to immune weakness. Angioedema is usually caused by allergic reaction to something, and angioedema frequently involves the lower lip, and it can even involve the vocal cords. This is a rarer manifestation of angioedema, and here the angioedema is involving the tongue. So you can see the tongue has swollen up and become very red, and due to swelling caused by release of histamine. Here is one more viral lesion in a patient with immune deficiency. This is multiple oral warts which are caused by human papillomavirus in a patient with immune weakness. Similar lesions occurring in the genitalia will be called condyloma acuminatum. This is another rarer manifestation of the human papillomavirus 13 and 32. The human papillomavirus in certain patients causes localized hyperplasia of the epithelium, which is called Haig's disease, and it looks like this. So it's not a very common manifestation. Thank you friends for listening. I hope this video is useful for you.